Hi, I'm Esthetician Trish McCarty. I'm the medical esthetician at Marshall Plastic and Reconstructive Surgery, and I'm here to talk about microneedling. I posted recently on my personal Facebook page that I cannot wait to microneedle my face, and I had so many questions come through my inbox. Mostly it was the same question. Why would you do that? Why would you put 36 needles in your face and think that's normal or good? So I'm going to explain why in this video. So if you see me look off to the side, I have some notes because I get to talking and rambling and I may forget what I was talking about. So that is why I'm looking off to the side. So I want to talk about elastin because I rarely, if ever, hear anyone in my field of study talk about elastin, and I have no idea why, because elastin is extremely important. Why is it important? Because it keeps our skin from sagging. It keeps it bouncing back. So let's say my skin was starting to droop. Why would it be drooping? Because my elastin in my skin is damaged. It's breaking down. So the reason we like collagen P.I.N is it is creating a controlled wound to the skin, which causes collagen to be produced. It triggers your body's response to create collagen. So when we are putting the needles across the skin and gliding that around, the needles are over and over puncturing the skin, creating microscopic holes that are so tiny that you can't even see them. And it is making the body respond by saying, whoa, what the heck is going on? We need to bring in some collagen to repair this damage. So the collagen starts to be produced, and that repairs the damage. So that's how we can get rid of fine lines and wrinkles and soften and smooth out the skin and that overall texture, because it is repairing the damage that is on the skin. And it is strengthening and rebuilding that elastin, making it stronger, because the elastin is responsible for keeping our skin bouncing back and keeping it from, from skin damage. So the elastin in collagen is found in our dermis, and that is the very bottom layer of our skin. And what we see out here that's visible to the naked eye is our epidermis. That's your skin, or that's your body's largest organ, is your skin. It protects everything inside. And the outer layer is called our stratum corneum. And so we can do great things with dermaplaning, with microdermabrasion, things like that, exfoliating this stratum corneum. But what is really good is to get down to the dermis, which can be hard without getting at least somewhat invasive to the skin. So that's why I personally love using lasers to do anti-aging treatments, or I like to do microneedling and chemical peels, because it is going beyond the stratum corneum. So let's see. So the collagen P.I.N is able to get down to our epidermal-dermal junction. And you're like, you're what? That is a fancy way of where the dermis and epidermis meet. So let's say, you have all these layers here with this pad. So here's our stratum corneum up here, and there are several layers of skin. I won't get into all that. That would be a really long video. But this is our dermis at the very bottom, and this is where our connective tissue is. This is where the blood is found. The elastin and collagen is what you need to care about. That's where all this is found. And so somewhere through here is where the dermis and the epidermis meet, and that's what is known as the epidermal-dermal junction. It's a lot to say. So we bring in our collagen P.I.N, and this does not have needles in it because we want to be clean, and we open them a new needle every time we do a treatment. We don't share needles. So I'm just going to bring this over, and I'm gliding the collagen pin. Now I don't want to go too fast, but otherwise we're not really doing a whole lot. Now we are creating some collagen, sure, but if I go at a slower, I mean, I need to at least move it, because if not, you're going to get a pretty aggressive treatment in one area if it's too concentrated. So I'm moving it at a pretty slow pace, in my opinion. I don't want to go too fast. I don't want to be in a race, because then we're not getting enough, we're just not getting as aggressive of a treatment if we're rushing through. So this treatment, this procedure takes me quite a bit longer than like a laser, for example. And it's because I'm wanting those needles to get down in there and do its job. And it goes down to the epidermal-dermal junction. And I like that because it's very effective. It is very good at giving results. So I'm just using the pin like that. And then I like to use a 36 needle cartilage. And I'm going to try to bring this up. And that goes up to 3 millimeters deep, which is pretty deep actually. I didn't think it sounded that deep when we first got it. I'm like, oh, it only goes 3 millimeters deep. And then I looked at it and I was like, it's kind of deep, because it is. So we use the collagen pin to reverse signs of aging. We can get rid of fine lines and wrinkles to some degree. If it's very deep pitted wrinkles, or pitted's not the right word. Pitted is more the acne scarring. It's what we treat. That and wrinkles that they kind of indent. This is a great picture to use. See how these wrinkles are pretty deep. Now, I call this the unicorn patient. They claim that this was the result after 2 treatments, 60 days apart. To me, that's a unicorn. That doesn't happen very often. I don't know. I feel like they did something else too. They couldn't have just used microneedling unless this person was a unicorn, like I said. That's just my opinion. So deep wrinkles like this, that would be hard to achieve that result even in 6 treatments, in my opinion. So if someone came in like this, I would encourage them highly to see one of our physicians instead, for, especially Dr. Fautis comes to mind. He does profractional laser. That's going to be more beneficial for someone like this. Because yes, I can do a mini series of the collagen pin, and that's just the device we use to do our microneedling. So if you hear collagen pin versus microneedling, it's the same thing. It's just collagen pin is the device being used. So I would tell this person that they would be better off seeing the doctor, because they could get results faster and probably a little less expensive in the long run, to be honest. So someone like this with more crepey skin, and it's probably not showing up well on camera, but their skin is not as smooth, that the collagen pin does wonderful to treat. It really is great at smoothing out uneven tones and textures, even tightening those pores. You can never close your pores. I don't care what Pinterest says. You cannot close your pores, and you don't want to. But it does tighten them. So when we have very oily skin, or we have clogged pores like blackheads, whiteheads, it expands your pore. And what I tell my patient, it becomes kind of like a cavity, like you would think in your tooth, how it goes down and it starts to eat away that tooth. Only it's expanding the pore, and over time it is going to damage that pore to the point where it stays large. Whether your skin dries out as you get older, and even though there's no debris or anything in that pore, it still is permanently expanded from the years of it having that stuff in there. And that's why I'm big on extracting that out. Now, we don't want to extract out a big red pustule. That's not what I'm saying. But blackheads, different clogged pores that are not inflamed, yes, we need to get them out. So that's my 2 cents on that, and a bonus for this video. But it does help tighten those pores back. Collagen P.I.N is awesome for that. And I also use this serum that is from the Collagen P.I.N. It's a hyaluronic acid based serum. It also has zinc oxide, which promotes healing, and why we need to use a serum is it helps that collagen P.I.N glide better across the skin, because if you're dragging it, you're going to risk making like a scratch. It looks like a lion attacked the patient or something. Like, it's pretty dramatic. So you don't necessarily need to do all of that. So I don't recommend doing a dry needling, despite what some people say on YouTube. You got to realize that not everyone's a professional on YouTube who are making these claims, and please, please don't do it yourself microneedling at home. You can hurt yourself. So the most common area that I treat personally is the face and the neck. And I actually do quite a few chests as well, because a lot of people, as they age, their chest gets wrinkles, especially right through here. And a lot of tops designed for females especially, you get this V-neck, and so you see those wrinkles peekabooing. And the neck also tells your age. So if you're doing all these great things to your face and not your neck, at some point in your life, your neck usually catches up and it tells your age. So always be mindful of treating your face, neck, and even your chest. So I highly encourage people to treat those as preventative measures or reversing things. So if someone comes in who's like 20 years old and they don't have scarring, they don't have enlarged pores, they don't have wrinkles, they don't have anything going on, but they're like, I want to prevent aging. Collagen P.I.N is a wonderful treatment to prevent things, because it is boosting that collagen and elastin in the skin. I wouldn't say that they need to come in and get 3 treatments or 6 treatments in a year. I mean, we're not trying to reverse any damage, so 1 a year would be sufficient for someone like that, or even a nano laser peel, chemical peel, anything like that would be beneficial to that patient. Now, someone who's already getting signs of aging, like fine lines, crepiness, they may need at least 3 treatments to 6 treatments to really see a difference. So this is a process. You are going to need to set aside some time, some dedication. Home care is extremely important if you want dramatic and good results with microneedling or any treatment that you're paying a lot of money for. If you're going to pay $300, $600, $1,200 for an amazing treatment, and then you go out and you buy Olay or Neutrogena, ugh, you're hurting my feelings, first of all. Let me just tell you, you would be surprised at some of the products we sell here that are comparable in pricing as Neutrogena, Olay, all these things that you can find at the drugstore. They sell things to the general public that is safer, so they cannot put a high concentration of certain ingredients in their products. And sometimes they don't even want to. They say, oh, this has hyaluronic acid in it, which is pretty well safe for everyone because our body naturally makes hyaluronic acid. Sorry, this video is getting long because I can't help myself. I love to talk about this stuff. Super nerd here. Anyway, they could put like a couple little drops of hyaluronic acid in a big pot of ingredients that they have, and they can say, well, this is hyaluronic acid. Or, you know, their marketing makes it seem as though they have a lot of this particular ingredient in it, and that could be a lie. I mean, technically they didn't lie because they put a little bit in there, but how much is actually in there? That's the thing. And that's what you need to remember when you're investing in your products, is how much active ingredient is actually in there. So in medical grade skincare, they have to put a higher concentration. They just have higher standards that they have to go by. And to be honest with you, we have products as low as $26, $32. I mean, some of that is cheaper than, I don't want to say cheaper, but more affordable than Olay or Neutrogena. I have been to Walmart or Target, and I'm just looking around. I'm like, oh my gosh, they want $26 for that, and it has what in it? So you really need to invest in good quality skincare if you want optimal results, because you see your face much more than us as the provider sees you. So you really need to do that home care, and you really need to follow your provider's instructions for before and after microneedling. You do not want to tan. You want to avoid the sun as much as possible, and if you are exposed to the sun, use sunscreen. But no tanning beds. Please don't do that. It's bad news mixed with an aggressive treatment like this. And I don't want to say, some people say that the collagen pen is not aggressive and that it is no downtime. It depends who you see. It depends what kind of treatment you want. If you see me, you're most likely going to be red for 4 days to a week, because if I tell people, if you don't go a little aggressive, we're not going to get that dramatic of results. So some people disagree with that. As long as you're getting pinpoint bleeding, that is the goal. That is going to create a result. You have to get pinpoint bleeding. That bottom line, you have to, if you want a dramatic result. If someone has scarring or wrinkles, I go deeper in that area than I do the rest of the skin. So let's say this is the skin. Let's pretend this is super flat, but then it starts, oh, sorry, my stuff was falling behind me. It starts to get unlevel. So let's pretend this is a wrinkle or a scar. I don't want to do the same thing with my collagen pen here as I did on the rest of the face, because then it's just going to be the same. I want to bring this up and make it level with the rest, right? So I'm going to hit this area, this indentation, up harder to get it more level. So this video is way longer than I intended, and I think I got to the point. So if you have questions that maybe I didn't address, comment down below. And if I were to do a podcast, would anyone be interested? Let me know. Give this video a thumbs up if you found it helpful, and share with your friends. Make sure you follow my social media, my Facebook, Instagram, YouTube. I am Aesthetician Trish McCarty, same spelling at all 3 places. And I really am flirting with the idea of developing a podcast and blog, because I just love to talk about this stuff, because I'm a huge nerd. So let me know in the comments if you would be interested. Thanks so much. Bye.